Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, experts are seeing a faster transmission rate of COVID-19 in Metro Manila, and they warn this is just the beginning of the post-holiday surge. The Health Department denies social media posts claiming that the new COVID-19 variants have been detected in the country. Also, a step forward in the country's fight against the virus as the government signs a deal for 30 million doses of the Covovax vaccine. Health spokesperson Rosario Vergeire and Faberco Life Sciences Medical Director Dr. Luningning Villa join us live. Let's go straight to the source of the story. We have Health spokesperson Rosario Vergeire. Yusek, it's good to have you again. Welcome to the source. Thank you for your time.
Good morning po, ma'am.
Okay, let's start with the COVID cases. Over 2,000 cases recorded Monday. Last Sunday, it was almost 2,000. Last Saturday, also almost 2,000. Are we expecting this continued rise in COVID cases in the next couple of days?
Well, we are still monitoring. Actually, the past 4 days, we have seen this increase in the number of cases compared to our 7-day moving average since the holidays. But we have to look at it cautiously because, as we have said, during the holiday season, laboratory operations were at the minimal. No, they have received minimal specimens, and also we are looking at the behavior of people during these holidays that they were avoiding these facilities to get tested. We are trying to look at the trends right now, and for the coming week, if we are to determine, if we are to conclude that there is really a surge. But right now, we can see that really the cases are increasing.
So you can't say it's a surge just yet because maraming labs yung sara during the holiday season, and of course, December 30, possibly 31, and January 1 as well.
Yes, the laboratory outputs have decreased by as much as 30% during the holiday season. So we are looking at these trends that we just want to be very sure. That's why we need another week for us to be able to say that if really there are increasing number of cases.
So you're still cautious about these numbers the past 3 or 4 days, but would you kind of characterize this already as the holiday surge?
Oh, well, as we have said before, we are looking at a 14-day incubation period for this disease, the COVID-19. So if, let's say, we have seen people going out of their houses and going to these different activities for the holidays, maybe we can look at it as that the increasing number of cases may be due to this. But as I've said, we have to look at the other factors as well, like the laboratory outputs that we have seen that has been decreasing, that has decreased during the holiday season. So another week maybe so that we can further conclude. Yeah,
in fact, if we talk about the holiday surge, of course, we're looking at Christmas and New Year. So sometime by January, I guess 4, USEC, all the labs should have continued their operations in full capacity, supposedly, kasi that's the first day of the work week. And then now it's 12, so it's been about what? I'd say 9 days since possibly the labs went on full operation.
Yes, ma'am. But as we look at our laboratory outputs, January 3, we only had 891 detected cases, which were positive. So we have seen that the laboratory outputs really have started to normalize. Start January 4 and January 5.
Right.
So we are looking at another week so that we can, as I've said, further conclude if this is really the increasing number of cases.
1 week for this holiday season, Yusek Vergeire, but we of course had the Traslacion Feast. I wanted to ask you first and foremost, do you think it was a good idea that they proceeded with the annual event?
Actually, we had been in close coordination with the City of Manila, also with the Quiapo Church, si Monsignor Cornel, and even issued this statement together so that we can prevent people. But as we have seen, people, they just ignored these warnings and they went all to the Quiapo Church, to have these activities. So we think that this might aggravate our situation if ever there would be increasing cases.
And if we look at the dates, Yusek, so traslación happened January 9. So again, we're looking at a 2-week duration. So maybe the numbers, January 23, that's when you probably would have more or less a conclusive result if naging super spreader itong sa traslación?
Yes, we will look about 3 to 4 weeks from that time, that traslación happened, January 9. So maybe towards the end of January, this is where we will see if really the cases have increased because of this.
Okay, so let's talk about the variant. There's so many variants now, Yusek. You have the UK, you have the South African, you have the Saba variant. Ilan na ho ba yung variant that we know so far?
Well, as you have mentioned, there are already 3 that has sufficient evidence already, from the different countries. And then there's this another variant that they had been saying, this Nigerian variant, although there is not much evidence yet for this.
Okay.
But we are looking at this 4 variants.
4. And of course, there was that report doon po sa Filipino domestic helper who went to Hong Kong. Negative po siya pag alis ng Pilipinas, and then 10 days after, I think, upon arrival, doon po siya nag-positive for the UK variant. Any more information first on the domestic helper? And number 2, to follow up on that, the family ng domestic helper po sa Cagayan.
Well, according to our sources, the Filipina who arrived in Hong Kong, she was quarantined and then she was swabbed. She developed symptoms on December 28. She was swabbed on January 2, and after that, they got a positive result, and they sequenced it and identified the variant. And after that, she was brought to a hospital, and she was taken care of there. She is apparently stable right now. We were able to trace their contacts in her hometown, and we were able to quarantine all of these contacts. Also here in Manila, because she went to Manila through her manning agency, we were also able to quarantine all of her contacts here. All of them were subjected to RT-PCR and this genome sequencing. So we will know all of the results maybe by Wednesday or Thursday.
This coming Wednesday, so that's tomorrow or the day after. How long does it take, Yusek, for the Genome Center, I believe, to find out if they are, they are positive for the new variant?
Well, according to the Philippine Genome Center, it's really about 7 days. But because we have this immediate need for the results, so they process, and in about 3 to 4 days, we already know the results. What would be most critical would be the collection of the specimen from these sites that we identify. And also when they process, they still need to have this kind of information databasing. So that would take another day or so. So they give us about 3 to 4 days at the most so that they can provide us with the results.
And what about the social media posts that are actually saying nakapasok na daw po yung variant? Meron daw silang mga kaibigan or may kaibigan na positive na daw dun sa new variant, pero ayaw lang ilabas ng Health Department.
Yan nga, Pinky, maganda na tinanong mo yan sa amin. Ito ho namin ipaliwanag na wala pa ho tayong nadidetect na UK or any variant at all here in the country. Ito pong variant na ito, matatest mo lang yan at malalaman mo kapag ikaw ay nag-genome sequencing. So if ever meron ho tayong pasyente sa ospital, hindi mo yan makikita because nag-show siya ng signs and symptoms or nag-RT-PCR ka. You can only detect this through RT-PCR and the genome sequencing, and it's just the Philippine Genome Center, RITM, and UPNIH, which are capable to do this. So we have issued a statement last night that we are saying na hindi po yan totoo, and please do not add to the fear of the public by issuing this kind of statements.
very clear coming from you, Yusek Vergeire, that the UK variant is not yet here dahil yung pong tinest na naging close contact nung nag-positive po sa Hong Kong, dito po sa Pilipinas, hindi pa lumalabas yung resulta. Wala pa pong kahit na isang resulta na lumalabas doon sa mga contact persons nung domestic helper sa Hong Kong. You can say that for sure.
Yes, I am sure about that. The results will come out maybe tomorrow or Thursday. As for the last week we issued results wherein 300 plus specimens were processed and wala po tayong nakitang UK variant or any type of variant doon po. Yun pa rin hong variant na existing dito sa Pilipinas, ang nakita doon, yung D614G po.
D614G. And to make it very layman, Yusek, ibig sabihin, pagka sinuri na to ng Genome Center at nakita na hindi itong hindi itong variant na common, dun lang malalaman na this is a different variant and this could what? This could possibly be, can we determine, is this the UK variant? Is this the Sabah variant? Is this the South African variant? Or is just going to say that it's a different variant?
Yes, ma'am, we can determine what type of variant. Kasi po, sa isang sequencing na ginagawa, yung whole genome ang ginagamit. So with that whole genome, you can find all the types of variants. Kung sakaling meron, makikita po yan ng ating mga eksperto dyan sa Philippine Genome Center. And as we have done the processing of the specimens, wala po tayong nakitang ganyan. Kung hindi, ang evident pa rin dito sa ating country, yung existing variant na meron tayo.
And how many tests results are going to come out tomorrow or the next day? Ilan
Yes, ma'am. I'm sorry. We were able to collect about 500 plus specimens. Aside from those coming from affected countries, we got samples from Visayas, from Mindanao, and from the clustering, the areas with clustering here in Metro Manila. We wanted to expand the coverage of this collection so that we may be able to find this variant, if ever it is here, from these vulnerable sectors.
But I wanted to ask you, ma'am, ilan po yung results na inaasahan ninyo from the Filipina in Hong Kong now?
We were able to trace the contacts, so we are looking at about 30 plus results.
Okay.
Both from the hometown and here in Manila.
In Manila. Yun pong doon sa aeroplano?
Yun po, yung mga kasama niya sa aeroplano ay nasa Hong Kong. We were able to coordinate with them. Nakausap po namin sila. And they were also quarantined din naman doon. So they are being monitored as well.
Just one more minute of your time, Yusek. Ito po kasing vaccine, I saw today in the news that I think it was you, was it you that said there's actually 2 vaccines that are coming in February? One is already has been identified, yung pong Sinovac. Ano po? What's the second one?
Ma'am, I'm sorry, but it is really the vaccine czar who has that authority to disclose any information regarding this. Yes, ma'am.
But you're confirming dalawa pong vaccines na darating sa February?
Yes, ma'am. That was what was presented yesterday in the Senate by the Secretary.
Okay. So maraming salamat po sa inyo, Health Spokesperson Maria Rosario Vergeire. Thank you, ma'am.
Thank you very much po.
And the Philippines signs a deal, this one for 30 million doses of its a vaccine called Covovax. When we return, we get to know more about this vaccine. Faberco Life Sciences Medical Director Dr. Luningning Villa joins us live. This is The Source on CNN Philippines. Please stay tuned.